Reddit, what is the most unprofessional thing a doctor has said to you during a visit? My family doctor keeps on telling me to avoid becoming a family doctor. I don't think she likes her job that much. Or she doesn't want competition. I was bleeding from my butthole. Turns out I have Crohn's. But that's another story. Anyway, this was before I was diagnosed. I went to the doctor to tell him I was pooping blood. So he said, let's have a look. I pulled down my pants, laid on my side, and put my knees to my chest as he shoved his cold latex covered finger up the Hershey highway. He yanked his finger from the airtight grasp of my sphincter, looked at it and said, yup, there's blood. He then shoves his finger an inch in front of my face so I too could confirm there was crappy blood on his glove. When I say it was an inch away, I'm of course exaggerating. It was actually much closer because I flinched and his crappy bloody finger touched my nose. I found a new PCP after that. Horrible story told hilariously. Hershey Highway sounds like a crappy, haha, version of Rainbow Road. I was 18 and getting 6 stitches under my eyebrow after catching a softball with my eye socket. I asked the doctor if there would be much of a scar. He said, well, I could use the smaller thread to make sure there won't be any scar, but it's not like your model or anything. I still have a visible 2-inch scar, 21 years later. So, if he was trying to be funny because he was such an awesome doctor, he didn't succeed at the awesome part. Wrecked. I went to see my doctor once and ended up breaking down and telling him about my suicidal ideation. He asked why I hadn't killed myself yet. I told him it was because it would be embarrassing and I'd feel guilty. He said, well, you wouldn't though. It wouldn't bother you at all. You'd be dead. What's there to worry about? Oh crap. I shouldn't have said that. This is why I'm not a psychiatrist. Please forget I said that. Now if I had to rationalize that, I would say he was trying to get you to say because I love my family and friends and then just fricked up horribly. During the breast part of my annual exam, the lady doctor told me that I had very fibrous breasts. When I asked her to repeat herself, she said, what? You never noticed your breasts feel like spaghetti? On her way to the next breast, she tapped my nose and made an audible boop. My close friends now call me Spaghetti T. I pictured the doctor as Pam from Archer, just for your information. Our daughter was having terrible sleep apnea. We had an O2 monitor at home and it was just going off all night long for months, leaving 2 sleep-deprived parents. Doctor said, we don't think your daughter needs her adenoids and tonsils out because let's face it, no one ever died from sleep apnea. I hope you got another doctor ASAP. Sleep apnea has been implicated as the cause of SIDS. Went to my family doctor for severe leg pain, swelling, cramps, textbook signs of a thrombosis, and he told me that it was nothing. 2 days later, the blood clot that was in my leg migrated to my lung and I almost died. On my next visit with this doctor, he said that he saw in my file that I had a pulmonary embolism. Then he said, wow, that was really unexpected. I got a new doctor. I was about 16. Right after my doctor asked what I was doing about my acne, I asked about birth control. He said birth control makes girls my age promiscuous and wouldn't prescribe it. Fast forward to age 26. Still had terrible acne and scarring. Finally diagnosed with polycyclic ovarian syndrome. Treatment? Birth control. He said birth control makes girls my age promiscuous and wouldn't prescribe it. Mayo WTF. I'd been going for tests for potential testicular cancer for a couple of years. They were thorough and kept asking me back to make sure everything was fine. The regular consultant was off sick, so I had to see a locum doctor one day and he said to me, whether you have cancer or not, I can't say. It's all in God's hands. When you're a doctor, you should never leave things up to God's hands. Okay, I'm turning myself in. I'm an NP in internal med, and also a woman. One time I was seeing a new patient, and toward the end of our visit I comment that she hasn't had a physical in a long time. Would she like to come back for one? She asked, is that the naked exam? I replied, yes, we'll both be naked. She didn't come back. She missed out. I've seen that porno. It's pretty good. My Jin once had a mini breakdown and vented about what a cheating jerk her ex was. I don't hold it against her. I've known her for many years, and I had politely asked about her family. She was newly divorced and bitter, and clearly horrified at her outburst afterward. My chiropractor asked if I had my period yet. I was 13. and a boy. He then asked me to describe in detail what my average poop looked like. My mom was in the room and that was the last time I visited that quack. Well, why do you have kidney stones? I don't know. It's why I came to the doctors in the first place. Fellow kidney stoner here. I've gotten asked that by urologists way too many times. One even sent me home with a list of food he claimed would stop all stones. It was just cola and bacon. A doctor called me an idiot once. To be fair, I was returning less than an hour after getting a cast off to have one put back on. I also worked with him, so the lines of professionalism were somewhat blurred. I had multiple doctors ask me if I was on drugs after going in complaining of getting lightheaded and dizzy all the time. On top of that, I had a huge lump sticking out under my ear, so something was obviously wrong with me. I told them I thought it was a tumor, and kept being told that was unlikely, and then heard them ask my mom if I was experimenting with drugs because I was the right age for that. They gave me a drug test. I was actually a good kid, didn't do that kind of stuff. Said it came back fine and sent me home. Many years later, I had a doctor who wasn't a moron who told me that yes, I did have a tumor. Patient complaining of lightheaded and dizziness. Lump under ear. Suspect recreational drug use. Ordered drug test and advised parents. Drug test results negative. Problem solved. Patient sent home. As he was putting a glove on to administer a prostate exam, he said, "This is the part where I have to violate you." Reminds me of my prostate exam. Don't worry, I've got tiny fingers. Should slide right in. Got kicked out of a neurologist's office for asking for a non-narcotic pain med. He had me on Vicodin for 3 weeks, but told me there was nothing wrong with me and accused me of doctor shopping. He said I was too young to be in pain. 6 months after that I had a neurosurgery to fix nothing wrong and feel great now. Not to me, but to my mum. Before she had me or my brother, she had a miscarriage. The doctor broke the news to her by saying, well, whatever was growing in there isn't growing in there anymore. To add insult to injury, it was a twin pregnancy, and he completely missed the other twin growing in her fallopian tube. It ruptured and nearly killed her. That's a malpractice suit right there. If you can't find an intrauterine pregnancy, and even if you do, you should always look for an ectopic. This is kinda the opposite but a great story. My brother went for a physical and when they were touching his deal he said, and I quote, "This is the weirdest dentist appointment ever. Gonna say this at my next physical." When I broke down crying because I was on an antidepressant that wasn't working and I cried over everything, he threatened to send me to the psych ward because I refused to come to terms with my bulimia. I have never suffered from any form of an eating disorder. Still haven't come to terms, I see. When I was 13, I went to the doctor for a checkup and to get some shots because I was going to climb Mount Kilimanjaro. My doctor was from Kenya, so was pretty familiar with it, and he told my mom that I was gonna fail when I was in the other room. Came back a few weeks later to have him look at my knee that I fricked up descending the mountain after summiting. Mom was super smug. I had been recently discharged from a psych ward after a suicide attempt and needed to go see my regular doctor for something. One of the first things he said to me when he finally came into the room was, "So you still planning on doing that whole slizzy dicey thing?" all while making a cutting motion at his wrist. I changed doctors immediately. Slizzy dicey made me laugh. Went to a walk-in simply to refill a prescription I had been on for years. He starts to ask me something and cuts himself off. "Have you had?" "Wait, don't answer that. All young women lie." I was not impressed. What a freaking dickweed. I would have torn him a new one. Edit. Torn, not town fascipum. One family physician I worked for, turns out you tested out positive for HIV. Here talked to ICE TFTW for a referral to a hematologist, then placed her on hold immediately. Transferred the call to me. I pick up the phone to hear a 57-year-old straight woman crying on the phone. She took care of her HIV plus some that had passed and there was a blood exposure incident when he was dying. Butthole. When I got a checkup at 16, the doctor did the usual thing where she made my parents leave so I could tell her anything private. I had nothing to say and it irked her, so instead I got a 15-minute lecture on how I looked like a druggie and how she wasn't to blame when the cops found out. She concluded with advice to hide my supposed stash in my friend's car to bust them. All because I wouldn't confess to any juicy high school gossip like she wanted. Sounds like she was so high she mistook you for herself. Not sure if it's unprofessional, but it felt unusual. I was at an extremely low point. I have PTSD. She was going to prescribe me some medication but was umming and ahhing about it. She made me promise not to attempt suicide by overdosing and then gave me the prescription. It was weird. I guess I'm still here though. Antidepressants can increase suicidality in the first couple weeks, especially in younger people. Not necessarily said, but done. I was in my last month of my pregnancy with my first child, where I'm supposed to see my doctor every week until I deliver, and he refused to see me. Every week, the day before my appointment, I would get a call having to reschedule for another week for whatever reasoning he comes up with. I ended up going almost a week over my due date, hadn't seen my doctor for a month, and had no plans on induction cesarean if I did not go into labor on my own. Which thank fricking God I did. I never went to that office again. A doctor prescribed a new medication to me and stopped the other one cold turkey. A couple weeks later I was so sick that from withdrawal that I would have died had I not either gone to the hospital or switched back to the other one. He argued with me at the next visit that this drug, Seroquel, or quentapine, was not at all addictive. He actually got angry at me. Just so everyone knows, you can die from the withdrawal from certain medications. High doses of Seroquel should never be suddenly stopped. Don't use Seroquel recreationally. It literally won't do anything for you if you're not bipolar other than make you uncomfortably dizzy and drowsy. And not in a pleasurable opiate way either. Or pleasurable at all. You will feel sluggish and you're just wasting money. My mom got rushed to the hospital because she was having chest pain one morning, and as soon as we got there a swarm of medical staff started to work on her. The nurse told the doctor my mom had a spot on her lung that could be cancer and he said, "Well, that's what you get for smoking," without realizing we were right there. My dad said, "She's never been a smoker." The look on his face. She died 3 months later. So sorry for your loss. My mother and I had the same Gino. When I got up in the stirrups he goes, "You look just like your mom." I was mortified. Funny though. I have to share because this one has always stuck with me. When I was about 13 after I'd hit puberty, I started having regular periods and my flow was really heavy. I mentioned it to one of my girlfriends. We were in grade 8 at the time, and she mentioned that she had that problem too and her doctor and parents decided to put her on birth control, the pill, to make things easier. I was really excited and did some research, and next time I had an appointment with my GP I asked him about it. He downright said no, because freaking before marriage is wrong. Anyways, ended up suffering through horrible periods for 5 years, and once I got into university we had healthcare provided with our tuition and I went to the clinic for a sore throat and it came up that I wasn't on any form of birth control at 18 and she was shocked and wrote me a prescription for the pill then and there. Thank you to her. It is shocking how doctors are even allowed to use religious beliefs as an excuse not to prescribe something a patient needs, especially something like birth control, that really should be provided upon request anyway. Not to me but a patient I was in the room with when the doctor came in. Patient was sleeping, and her son was sitting with her when the doctor and I entered. Son, mom seems to be doing a little better today. Do you think we can start her on the new treatment? They had discussed at an earlier time. MD, we can, I guess. At this point it's just rearranging deck chairs on the Titanic. But what the heck? Regardless of the situation, that is pretty fricked up in my opinion. That is a really jacked up thing to say, but I do love that analogy, haha. Gave me a random trans ultrasound of my T during a normal annual lady parts exam. Not pregnant. Didn't think I was pregnant. No symptoms. She just went ahead and stuck it up there. I had no idea why until I saw that they billed my insurance company for it. I was a weak college boy who put his dong in the wrong place and got gonorrhea. I went to the quack shack, what we lovingly called student health, and the doctor came in to examine me. As she's checking my dong and feeling for the lymph nodes in my groin, she asks, "So, you hadn't say freaking, do you want to die?" That's not unprofessional, really, just hyperbolic. 1. I don't care if you cut yourself, if it keeps you from killing yourself. 2. Thanks for letting me touch your boobs. My doctor smokes in his practice. Well, that doc won't be giving out frick samples because he doesn't have any left. The first time at my OB-GYN when I moved to a new town to start a job as a chemistry professor, the doctor, knuckle deep in tea, was also glancing at my new file. "Oh, you work at College X. What do you do?" "I just started as a chemistry professor." "Man, I wish I had chemistry professors that looked like you." Optimistic view. Maybe they were hoping for more gender parity in academia for chemistry. My wife and I knew we were miscarrying. We went in for the sonogram to confirm the bad news. The lady who did the ultrasound was very quiet and said she'd get a doctor to speak to us. At that point we basically knew what the doctor was going to tell us. That's why we were extremely upset when she exclaimed congratulations when we walked into her office. She hadn't even bothered to read the chart. We were both already completely miserable, and that really made it worse. Even typing this now is making my eyes well up. It is estimated that 25% of pregnancies end in miscarriage. It is inexcusable that she wouldn't take the time to look at the notes in front of her when you have a 1 in 4 chance of having a woman going through one of the most horrible experiences imaginable. My wife and I are now 7 months pregnant and very excited for our baby girl, but I will never forgive that woman for making my wife cry like that. Frick me sideways, John. You've got a big dong, mate. Between your username and the sentence, you must be the most Australian man in the world. Not me, but to my mom, you're pretty old to be having your first kid, this is my 4th. I've had a lot of health issues that were difficult to diagnose. Being a young woman, I've dealt with many dismissive and insulting doctors who just don't care or think I'm making it up or just being a typical deluded female. By far the worst thing that was said to me was that all of my very real and debilitating pain was all in my head, that I was subconsciously inflicting it upon myself due to being abused as a child. Turns out I have about 5 other chronic illnesses instead, but it took me 6 years to get diagnosed because no one ever took me seriously. I am so sorry, I have been there too. My GYN asked my husband's consent when I had my hysterectomy. We have kids. I actually take him to appointment because they listen to him more than me. After I broke my wrist, my surgeon said a host of unprofessional things. 1. Your insurance didn't clear, so I'm not able to see you. To which I said okay, so what should I do from here? To which he snapped at me, listen, there are people waiting in the lobby who have their insurance together. Please come back when you have your insurance sorted out. We shouldn't have gone back after that, but she was the only surgeon available in the area who took my insurance, which wasn't expired. 1. Well, at least you don't play violin. Hahaha, I play violin, guitar, bass, and piano. 2. When my mother asked her if I needed the surgery or if my hand would heal on its own, she said, well, I'm a surgeon so I would recommend surgery. Yay, I suppose you would. 3. Once the first surgery was done and we came back in for an x-ray to check on the plate and bolts, I could see that they not only looked a bit crooked but that the bolts were literally poking out my skin. Like visibly poking into the skin. When I pointed that out, she said it will only be a problem if you like wearing bracelets. Aha, just like it'll only be a problem if I play the violin. Got it. Of course she did a complete hack job, so we had to pay her for a second surgery. I'm entirely unconvinced she didn't plan it that way on purpose. Despite her telling me the blatant lie that it would be a few weeks recovery time so I could get back to touring. Because I was a musician, I was in a cast for nearly an entire year and my wrist was left slightly deformed and with the nastiest suicide looking scar you've ever seen. I recently had the plate and bolts removed permanently because they came loose and the surgeon who removed them told me it looked like a 15-year-old had done the surgery and that the bolts she put in looked like they were from Home Depot. While doing routine weight and blood pressure, it's okay if you're gaining weight when you're pregnant. I was there to have an ovary and fallopian tube removed. I was getting a colonoscopy and the doctor said don't worry, it's normal to get an erection during this. I said I don't have one. He just smiled and said but I do. Okay, that is amazing. I was diagnosed with PCOS when I was 16, and it has caused me to have many issues since then, including yo-yoing weight. Last year, I saw a new doctor, hoping to be recommended to an infertility specialist, one of the many issues, and instead of giving me the recommendation, he told me that PCOS is a made-up disorder. and proceeded to pick on me for my weight and accuse me of lying about my diet and exercise habits. That punk made me cry. That sickens me. It is very much a not made up thing. It is testable. Seriously hate pricks. You need to report that to the board. While having some dental work done, my dentist asked me if I wanted my mouth frozen, but then said only pussies ask for freezing. I felt awkward, so just went without. I'm a girl and was 16 at the time. I'm 30 years old. I want to be knocked out if there is an option. I'm not trying to impress anyone. I want the crap they used to put escaped zoo bears back to sleep. You have been visited by the source Chihuahua. You will be blessed with good pasta, but only if you comment simmer well. Papa simmer well, Papa. Like and subscribe, you magnificent person.